Taking from one of Bonita's slides in her wonderful presentation about Save the Children, I titled it The Need for Normalcy. And I also want to thank Christine for her wonderful comments about the situation in Rwanda and how they responded to the genocide in the 90s. Okay, so we decided to look at our policy action points as prevention and prediction, response, and recovery. And although these seem very linear, we had a very robust discussion about the idea that conflict is not linear and it's often cyclical, in the sense that conflict often returns to the geographic region within 10 years of the original occurrence. So the idea is that these often need to be aligned so that wherever a certain area is within the conflict process, that there are response mechanisms available. So under prevention and prediction, we talked about tools and investments to predict conflict and understand key points for intervention. So first, what was brought up is the need for more evidence about what the impact of conflict is on young children. Because often we need those advocacy points to better influence democratic processes and actually prevent the conflict from happening in the first place. So the idea is that if we can produce messaging that says these are the number of children that are dying in conflict situations, or this is how it's stunting their development physically and emotionally, we could use that as an advocacy point to prevent conflict in the first place. And the second is to better understand the cycles of conflict in specific areas so that we can identify areas to intervene and possibly prevent conflict. The second point is coordination of governance and finance in other sectors. So to better align democratic processes with health and education sectors to respond to the needs before a conflict arises. The third point is capacity building within the government and civil servants, because often these are the first individuals to know that something is brewing within a specific region of a country and what specific services will be needed during the different points within a conflict, or to be able to have certain actions take place so that the conflict does not escalate. And the last is just strengthening existing platforms, and this idea was that if you have strong democratic platforms or strong ECD platforms, it's much easier to transition those to meet the needs of the communities and families during conflict. The second area is response. And so this would be during the conflict, in the conflict zone, but also includes the refugee camps. And so this is coordination of governing, finance, and programming, which you saw in the earlier slide, but this is talking about it also at the refugee camp level. So what can we do to provide better services within the refugees so that those who are living there feel like they're humans and individuals and that they matter as a person, so that they're not falling prey to criminal activities, or we talked about young women and children that are exposed to abuse in those camps. And then also universal programming is extremely important, but also the need for targeted programming and understanding what those children and families that have been exposed to severe trauma would need as opposed to those that are receiving the universal programs. And the last point for the response is evidence on the impact of programming in the short and long term. So being able to assess how the programming is impacting the families. We did have a discussion about how this could possibly be linked to financing and how linking it to financing might produce more coordinated financing efforts rather than working through sectors, but working through regions or organizations, so that we're looking at the situation of the family in a more holistic way. And the last is recovery. And a lot of these actually, as I said in the beginning, it's quite cyclical, so a lot of them feed back into prevention and the response as well. And so in terms of peace-building activities to target young children and adolescents and to focus on their psychosocial health, in the sense that if we know that conflict is cyclical, if we can address these children and prevent them from falling prey to becoming soldiers or guerrilla fighters in the coming years when violence might erupt again. And then family-centered programming that looks at the needs of the child, the family, and the community. And this builds on the last point, which is building up existing platforms. And so it's looking at what's already there and strengthening those systems to address what is needed and not just what we bring to the table, as we talked about yesterday in one of the presentations. So I believe that is all. I hope that my group agrees with everything that I have presented, and if not, I'm sure you can chime in during the question and answer session.
Really interesting, and at least I have learned, I haven't worked in emergencies, I've learned so much from the participants. And there is so much to be said, and we tried to trim a little bit the lengthy discussion that we had. So I invite the colleagues who were in the room to jump in and say if anything had been missed. We were so busy that we really left at 1 before 12. We almost missed the coffee party, so I'm sorry for not having any PowerPoint to present. So I think the main thing we want to communicate are the main principles that the group felt needs to be taken into account when discussing ECD and emergency and outbreaks. First of all, I think a critical point that came up was that there has to be an ECD system and policy, and this was discussed in the first 2 days, without which any response to an emergency will fail. So I think a critical point is trying to create an ECD response when there is no ECD policy or capacity already in existence will be almost extremely difficult. So that's where the discussion during the first 2 days comes into play in terms of recommending to governments how to manage children and families during emergencies and outbreaks. The second principle is that it needs to be understood that outbreak is not just a medical issue. And currently, the feeling in the room was that this is primarily how it is looked at, and that's where ECD is also falling through, because when you deal with children, you cannot just treat it from a medical lens. And there are many other things that are ongoing, either psychological or education or even school, going to school, staying at home, where the kids are being cared for, and the expertise to manage this are not necessarily just the medical profession, and it's not just a disease-related issue. The third principle is that when dealing with outbreaks, there was a very strong point that infectious outbreaks are happening in the context of other disruptions. And the other disruptions often exacerbate and lead the outbreak to become an epidemic. So during other disruptions, ECD need to be taken very seriously, because that might be a way to prevent later on epidemics. So this context needs to be accounted for. A fourth principle was that listening and working with communities and listening to indigenous knowledge during the outbreak, before and during the outbreak, is critical. And we heard yesterday, I think, from Steve, his example of the US support and the Liberia response. And we heard today in the group quite a few examples where the local communities, who are the first line of response, they often know quite well what works. And listening to them and also helping leaders understand how to navigate between the different advice. Often they will give one advice from donors and from UN agencies, and a different viewpoint will exist locally. And there has to be some bridging between those knowledges and those expertise. Another principle was the principle of leadership. All those in the room who are very, very, very unfortunately, but very experienced with emergencies and outbreaks, said that the first and most important thing was the response of leadership, of the presidents, of the heads of states. So sensitizing them to early childhood development, to children, to families, but also understanding the epidemic is critical, and often they are infected themselves by fear and panic, and their response again exacerbates fear and panic in the community and also in the media. So training before and during leaders and ensuring that their first response is one that is conducive to increasing national, international, and local resources is critical. And then, critically, from a more concrete point of view, the point is to ensure that within any preparedness system there is a specific reference to ECD, and all the people in the room agree that currently children are treated as adults, and children should not be treated as adults. So in every preparedness system and protocols in any country, there has to be a protocol that is specific for children and for the specific ages. And that was identified as one of the primary gap. Within this, of course, we had some general recommendations, including data collection and early warning system, mapping of all the organizations that are dealing with ECDs in countries, so that during emergency, those who are dealing with the emergency know who to go to and who is already on the ground. And I think that ties nicely also to the systems approach that we had yesterday at the end of the day. Another point was that there has to be a coordinating structure. There was an agreement that chaos will always exist, but the success of dealing with the outbreak will depend largely on the speed of managing and coordinating the chaos. There needs to be a national lead agency within which there is an ECD expertise. A very good point came in that there are many, many small emergencies. So there are many small outbreaks that are not, because they may not be a threat to the global community, nobody really deals with them, and that those can be small, laboratories in a way. They shouldn't be ignored because they're important, people are affected, but also they're an excellent opportunity to test and to develop good responses. And often those small emergencies affect primarily children, from diarrhea to cholera and other infectious diseases. The training of teachers and the children themselves, how to respond in emergency, was a very interesting point. Somebody gave an example during the children in some countries have been trained to deal with terror, so a similar approach to epidemics should be given as a tool, as empowering the children and their teacher in the community to deal with outbreaks. The protocols need to be very specific for children and parents. There were specific examples that on both the cultural and the age issue of, for example, the body bags that often they are only for adults, they are not for children, or for example they are in not appropriate colors for certain religions to even use them. So and that of course leads to it halts the dealing with the epidemic. So making the protocols very specific, culturally and age specific, came up again and again. And I think those are the main points. The only thing that I would add, a few of us discussed during the break, the need for the forum maybe to consider taking some of those a little bit still high level principles and translate them into maybe specific protocols by the experts in the room that are specific to ECD. Thank you.
So our group is group 2. We're dealing with natural disasters. And we drew from experiences from Nepal earthquake, for instance, the drought and famine in Ethiopia, the earthquake and tsunami in Japan, Hurricane Katrina and Sandy in the U.S. So these inform a lot of our discussions in our group. It was generally felt that there really need to be, we need to look at things at a family, community, and national, international level for completeness sake. And we should focus on preparedness, response to natural disaster, both in the short term as well as longer term, and of course policy, including financing. Next. So at the family level and the community level, we talked about focus in empowering communities on disaster preparedness response, because it's not always the case that the government can be there immediately to provide assistance. So if that capacity is within the community, we feel that that could be to the benefits of families. And that and we should prepare them through education. For example, is there opportunity through Parent-Teacher Association or through pediatrician to inform families and community about preparedness measures, and training and drills when it's possible. Of course, that's not possible in all communities. And there talks about a local preparedness kit focusing on children's needs, things like shelters, nutrition, family, play, and education, with emphasis on restoration routines, but there's strong evidence available that by restoring routines actually is to the benefit of children both in the short term and longer term. At national level, we talked about the importance of national inventory to understand the capacity in the country, both in terms of skills as well as infrastructure that would include resources and equipment. There's some discussions about, for example, the equipment that are available in hospitals. Are they really functioning? Are they so that they can be useful when disaster strike? Importance of multi-sectorial integration in terms of integrated preparedness response was discussed. For example, interministerial committee that can look at these issues, and the ability to self-report and the idea of collecting this data at national level. I think it was touched on yesterday in terms of the Ebola crisis, just to know, where you are, where you're going, what you're doing, and that could be very helpful for a response to and preparedness and response to natural disasters. Of course, there need to be special attention to vulnerable population, because they usually are the ones that perhaps have some most challenging issues during natural disasters, and there's a strong recommendation for integration of community-based response into the national response. And we also think there are some issues that are more cross-cutting across all levels, community, national, international. Financing is one. Recommendation is that there should be some community resources, maybe community funds. Certainly there should be a national disaster preparedness and relief fund. And the idea of an international insurance scheme, the idea is that all countries pay into a fund so that potentially high-income country can supplement the needs of a low-income middle-income country was discussed as well. And certainly NGOs at all levels should have specific disaster preparedness response plans. And I think that's the core of our discussion and conclusions. Of course, any of our group member, please speak up and neglect anything. Thank you.
Thank you very much for the presenters, and the floor is now open for discussion. So we will continue with the discussion until 1. So you can address your question to any of the members here, and I'm sure the group members will also be able to participate.
Thank you for all the groups. I think, as I see the 3 groups, it's almost a similar thing that came out. The preparedness, the response, the policies, the financing. I think if you summarize the 3 groups, specifically for the human-induced, and I think we discussed it in our group for outbreak, that it's important to differentiate, even in the human-induced, you have different phases on that human-induced, and it's different type of response. And I think it's important to differentiate. For example, when the conflict just happened, it's a different situation, like people are in transit center, people move around. It's a different type of response or different type of measure that you do. And it's a completely when people are in the camp and we know they will be there for 10 years. And how do you start stating it? And I think it's important, I mean, emergency sector, if you come with the early child, the ECD in emergency with 20 or 100 different staff to implement every time, it will not happen. Then is how do we get more specific for each of the stages in the first 2 days after a conflict, or after a flood or thing, and the 10 days or the 1 month or 6 months. I think it's important to differentiate that because it's different type of response and capacity at that time. Thank you.
I would say that that's something that we did talk about in our conversations, and unfortunately I couldn't share every point, but that was brought up that there are different points in the process of the conflict, and then there are also different locations of those being affected by the conflict. I would ask if anyone from my group could respond to it more specifically, as this is actually one of my first experiences is looking into emergency situations, but I would definitely agree with your point that there are different services needed and different service delivery methods. Is something that Bonita brought up, is often the basic needs of the children will stay the same, whether it's in a time of peace or a conflict or an epidemic, but the service delivery must change to best get at the affected children and what their more specific needs might be. So would any of my group like to chime in? So I guess it's a topic for further discussion that we're not exactly sure of the answer. But thank you for your comment.
Mine is a general comment for this proceeding. I see it is high-level participation of academia and practitioners, but a little bit low level of policy makers, I would say. This is my insight. So I don't know, a lot of time again, we talk about series of conferences, but to bring it to high level than this, I would suggest inclusion of more policy persons and what is the future direction of these conferences. That's why I said general, it's not only for this group, for the whole this workshop.
Kimber, do you want to make a comment?
Yeah, I completely agree that the goal of this forum is to use the evidence and the science that we know, as well as practical wisdom, which is why we heard voices from the ground and in the communities, to help inform decision making. So I think that my fellow forum members couldn't agree more, but I would invite the forum members to chime in as well. Thank you for your comment.
Similar to the first question or comment, I was also struck by the similarity between the three and the overlap. I'm curious if there's any, not just to the panel here, but anyone in the room that has any kind of key differentiators between the three that are particular aspects that need to be thought of in context of ones that are particularly for armed conflict or natural disasters or outbreaks, or are these really just broad categories, but the types of responses that we need to think about are actually under different sections, like response versus prevention and preparation?
Let me just make a brief comment, and then please, others if can. I do remember when the discussions were made early to prepare for this workshop. That is exactly from where we got started, I believe. At least my own thinking was that to make things more specific or distinct, we thought categorizing them by these three groups will be, but seeing now the discussion, it seems like there is much of overlap to make this very much different. And if I were in the field, probably I will just manage it as it is. I wouldn't differentiate between from where it got started, whether it was induced or whether it came as a natural, it led to an outbreak. Probably that is how I will manage it. But certainly an important, a very interesting point.
Can I think,
Yes,
I think I'm a disaster type specialist, and there's some differences, and even on the response, there's some big differences that are some of the key principles. For the human induced, usually you have a collapse of the state. In general terms, you have a collapse of state, you have a disruption even of the system and the state that actually will make sure, usually you will have external more to do. Then you cannot count always on the government to do it because they themselves are part of the party of the conflict. And you have a lot of uncertainty and really rapid movement. And you cannot, for the human induced, you'll have people moving really rapidly. You have a lot more trauma because you have killing, you have security issues, and people move and change rapidly. And then they will be stay in camp for 10 years, 5 years. That is the human induced. For the natural disaster, usually it's an event that is in one day. You have a 1 day, of course the drought is a little bit different, but the rapid onset is 1 day event, and the event is finished. And now you deal with the consequences of that event. Then you have, like, in a way, the threat disappeared, the earthquake is gone, the floods is already happened, and then you have to look at dealing with the consequences, and then you have less security issues. Of course, you have like the earthquake, like in Haiti, people were in camp for, and still in camp for 2 years. Earthquake is specific because people lost their house or the thing, but you still have a sense of community that you don't have in the induced. They usually lose the sense of community. Then sometimes even the communities become difficult to deal with community in conflict, when in natural disaster they still keep the community basis, and you can do that. In outbreak, because it includes a lot more technical, we tend to look at it as a technical because there's an element of technical, but it's actually have to deal a lot like natural disaster because it includes all the sector, but you have to have specificity technical. That is, I don't know if I answer, but these are some of the different elements that you have to look to characterize, and at the response you have to take into account some of these specificities.
So, Steve? Who's there?
Yeah, I think that's a valuable, I don't know if that's going to be true in the future. And I would encourage you to think about the confluence of disasters in the future from climate change, where we're going to increasingly see conflict arising from climate change, resource scarcity, food security issues. And I think we have to think a little bit more about the type of disasters we're going to face in the next 10 years, learning from the disasters we've already seen in the last 10, but really focusing on a very, very changing global climate and its impact on emotions and politics and power. And I think we're going to be facing a new type of disaster, natural disasters which last far longer than a day.
Janice.
Thank you. I think part of the issue, and Amalia alluded to it, is that when you have to present at a high level, and there are more specifics that we talked about. I think if I could think of one thing that really resonated in our discussion was the need to build community trust and the importance of community trust, because you're asking communities to put a lot in the stake of the leaders. And if there's not a two-way dialogue going on, then that's when everything just goes out of control. So I think, drilling down to some of the specifics, as Amalia alluded to, I think you would find some differences. Thanks.
I've been part of groups that study resilience across systems, and they're interested in the similarities among these different types of scenarios we're discussing, because we are all involved in, or need to be involved in, all hazards planning. And some of the ideas coming out of the resilient systems folks are that, life as we know it is the result of the interaction of many systems at different levels. And we don't want to concentrate all of our efforts and preparedness at one level, whether it's the community level or the national level, that you need to think about, building resilience within systems at different levels. And then even when they break down into pieces in a major disaster, that they can have the capacity to reorganize and reconnect and so forth. So I think the scenarios discussed are usually the same ones we discussed here: pandemic, natural disasters, conflict, or these, as I agree with the point that we're going to see combination disasters more frequently, where you have an acute natural disaster on top of a chronic political unfolding conflict situation. So, we have to think about how do we integrate our capacities across levels, but also how do we build resilience within systems so that when, on a temporary basis, they disaggregate. That's what happens, in a major disaster. All the systems collapse at the same time, and then they begin to reorganize and reconnect. And I think we have a lot to learn about how to do that. And if you're focused on children, you have to think about all these different systems. What do people need to know? What do we need to do to prepare at a family level, a community level, at the school level, at the national level, and so forth, so that everybody is thinking about protecting children and has some capacity. We need distributed capacity. I think in our group what came up again strongly, I tend to agree that we speak at a bit of a high level and the principles might be the same, even though I think we do have some principles for the outbreak that are slightly different. For example, it's not just a medical issue. That's, of course, it's true for others, but we do see different circumstances for the different emergencies. But I think one point that came in our group is, for example, when you look at disease protocols, those can be made very specific for each particular disease for children, which they are currently, according to the participants in the group, are not. So looking into trying to forecast and looking into past epidemics and looking at existing policies and protocols, that's where probably the specifics will differ between the principles will remain the same for many different kind of emergencies, but the specifics will have to differentiate. And again, I think that's one thing that the forum could take forward in the future to make it more specific. But I think one point that Jens kept bringing up in our group is not just the preparedness for emergency, but if you have ECD capability in the country, even if systems collapse, even if you have an epidemic or if you have a political crisis, if the system, if the knowledge, if some experts are on the ground, you are better off in terms of managing any crisis. So the starting point would really be to look at that not before, but parallel to the specifics of each crisis.
Any further comments? Okay. So we thank the presenters and the groups for their effort. So let us probably give a hand to the entire group.
First of all, thank you all very, very much. You are the resilient ones. You have stuck with us now through 3 days of meeting. And so first of all, I just want to thank you for that. Your input has been extremely useful. It's all been captured over 3 days by Jocelyn, who is going to be writing up a summary of this report. So your comments aren't lost. There will also be a workshop in brief for you to then circulate to your colleagues, to policy folks, to whomever. You can also circulate the 100-page summary, but some people prefer the 6-page brief. So there's something for everybody there. And so those will be coming out over the next couple of months. And those are peer reviewed at the National Academies, both of them. They'll be reviewed by people who are in the room and people who are not in the room, just to make sure that everything is very clear when it's clearly written. So everything's written jargon-free. So the products are made for a very broad audience. So I just want everybody to know what the next steps are there. But the more immediate next steps, we have lunch for all the participants here. I believe it's out there. Oh, in the atrium. And, but the forum members need to go back to the Harar Grill Room for lunch, because we will have a closed session meeting. We'll be digesting all of what happened over these past 3 days and begin planning our next steps going forward. Our next meeting is November 2nd through 4th, and it is in Prague, in the Czech Republic. So we will have that live webcast, and so we encourage you all to sign up to the IYCG listserv and follow us. We will be discussing children living at the margins, marginalized children, including children with disabilities and their caregivers. So I just wanted to close by again saying thank you very much, and I want to give you all a hand. Thank you.